As you can see, I'm standing outside in the middle of an ice storm. Mind you, this is not normal for April spring weather. It seems wrong, and it's progressed so quickly and fast today. Much like the outcome of this case, Wilson v. Beck. None of what happened, or what didn't happen by the healthcare providers, I should say, was acceptable, and things can change in a person so fast. Just like how yesterday it was sunny, I was wearing a t-shirt, and today I'm wearing a jacket, probably should be wearing hats and mitts, and actually probably should be going inside. Imagine going to the doctor, feeling worse by the day, and still being told that you just have a virus or that your symptoms aren't that serious. Well, this actually happened, and it happened to a guy named Kenneth Wilson, and it ended up costing him his life. This is the tragic story of Wilson v. Beck, a case that changed the conversation around medical negligence and patient rights. So this all started on December 22nd, 2003, when Wilson went to see Dr. Ian Beck for pink eye. And Dr. Ian Beck prescribed him antibiotics and were told to take them for 5 days. 5 days later, Wilson started to feel a lot of pain and unusual symptoms. He had dizziness, burning sensation in his stomach, a very high fever, diarrhea. A couple days later, his wife Trisha, who was also a registered nurse, told him that he should go in and see the doctor. And at the appointment, Dr. Beck diagnosed Wilson with the stomach flu and ruled out any bacterial infection and told him to just stay very hydrated. On December 31st in the early morning, Wilson was startled awake by his cat, and when he woke up, he felt a very sharp shoulder pain. As a result of his shoulder pain, on December 31st, Wilson, his wife, and his brother ended up going to St. Joseph Hospital, and his wife completed a SARS form noting fever and chills. The triage nurse then did not document his symptoms and did not take his vital signs. And then Dr. Habdank, a first-year resident, examined him, diagnosed a soft tissue injury in his shoulder, gave him pain medicine, and discharged him. The supervising doctor, Dr. Cram, approved the diagnosis but did not personally see Mr. Wilson. This then brings us to January 1st after midnight, so New Year's Day. Mr. Wilson struggled to breathe in the bathroom, and his wife called 911. Once paramedics arrived and they were fully unaware of his medical history, they assumed that the shortness of breath was due to his fever. They discouraged a hospital visit due to New Year's Eve crowding. In the next few days, Mr. Wilson was starting to feel some improvements. So he had a slight fever reduction and some of his appetite was starting to come back. But do we really think it ended here? No. On January 5th, he became disoriented and unable to swallow mucus. His wife then booked a doctor's appointment, and when his brother arrived to take him, Mr. Wilson did not recognize him. Very strange. On January 5th to 6th, he was admitted to St. Joseph Hospital and transferred to the ICU. An echocardiogram on January 6th led to the final diagnosis of an infective endocarditis, IE, which is a really serious bacterial heart condition. On January 7th, Wilson was then transferred to LHSC, where doctors admitted they could not perform the surgery due to the impossible out-of-control spread of the bacterial infection. This is a very sad case because by January 8th, Mr. Wilson had minimal brain function, and then on January 9th, he passed away. This case was brought to the Ontario Superior Court of Justice in 2011. The case found that Dr. Beck and Dr. Habdank were negligent in the diagnosis and the treatment of Mr. Wilson. Dr. Cram, the supervising physician, was ultimately found vicariously liable for Dr. Habdank's negligence in treating Mr. Wilson. Dr. Beck, the family doctor, failed to recommend follow-up care despite the persistent fever and was found negligent for not properly considering the bacterial infection. Dr. Habdank, the first-year emergency resident, did not review the SARS screening form which documented Wilson's fever and was found negligent for failing to consider an infection. The total damages awarded at the Ontario Superior Court of Justice was around $557,000. The case was then brought to the Ontario Court of Appeal in 2013 and upheld the negligence for Dr. Beck and Dr. Habdank, but overturned it for Dr. Cram. For individuals in the healthcare system, this case means to fight. It raises awareness about medical negligence, patient rights, and the need for you to advocate for yourself in hospitals and with doctors. You need to advocate for yourself and trust yourself, because if you don't trust yourself and you don't advocate for yourself, no one else is going to do that. If your sickness persists, you need to push yourself for a second opinion, get out of your comfort zone, and if a doctor isn't listening, speak up, because no one knows yourself better than you do. Second of all, your medical history matters, so doctors are supposed to review everything you have filled out, past forms, past sicknesses, past illnesses. So you have the right to ask for your records. This one should go without saying, but clearly this was not the case in Wilson v. Beck. Emergency services, hospitals, doctors should take you seriously. They should not be dismissive of your symptoms, of you wanting extra tests, extra care. Don't let anyone tell you that it's just something, like it's just a virus, because it's happening to you, so it's not a just situation. My advice to any individual in the healthcare system right now is stand up for yourself, speak up for yourself, and advocate for yourself. The Wilson v. Beck case is not just about one misdiagnosis. It reveals the broader systemic issues that are happening within healthcare systems today. This case highlights the gaps in how medical residents are trained and supervised. Dr. Habdank, a first-year resident, missed the critical signs of infection, and Dr. Cram, his supervisor, failed to intervene. Therefore, better mentorship and oversight of inexperienced doctors are essential in making sure that misdiagnoses and dismissals don't happen like this. This case shows that healthcare systems have to improve communication and track patient histories through maybe electronic records and paper records to kind of cross-reference both. Hospital policies and healthcare systems also need to be stuck to more than they are right now. So there's clearly some flaws in the healthcare system, in documentation, again, with communication and with their policies. I think with this case and the many that have happened and undoubtedly the many to come, this calls for stricter policies, it calls for stricter hiring protocols, it calls for stronger documentation requirements, and greater medical accountability. With all that, I think the number one word that rings in my head for what this case means for the healthcare system overall is accountability. Everyone working in a healthcare position in the hospital, caring for someone else, needs to be accountable for their actions. And I think through having better training in the staff, having stricter health policies in hospitals, healthcare professionals can feel like they're not doing it on their own and that there's supports there. Key takeaway from this case is that no patient should be overlooked and your health is worth fighting for. You need to trust yourself and you need to think of your life like it's on the line in these kind of situations, because it very well could be. And you don't want to be the next case discussed. Looks like the ice storm's still going on, so be careful.